Malnutrition is a global health problem, having the highest prevalence and impact in low and middle income countries. Malawi is among the many countries that are experiencing a double burden of malnutrition, a high prevalence of undernutrition alongside growing overweight, obesity, both challenges underpinned by unhealthy diets. Skilled human resources are needed to ensure appropriate treatment and prevention of malnutrition. The 2009 National Nutrition Policy and Strategic Plan identified a lack of skills in these areas as a key constraint to improving health services. The Feed the Future Innovation Lab for Nutrition, funded by the United States Agency for International Development USAID, designed and implemented solutions to close the identified gaps.
The Feed the Future Innovation Lab for Nutrition is hosted by Tufts University at the Friedman School of Nutrition Science and Policy, and it is funded by USAID. The key goal of the lab is to build academic and research capacity in host countries. In Malawi, the program specifically sought out to build capacity in nutrition in response to national priorities. In particular, it seeks to provide host country professionals with education, training, and research support. In Malawi, the three flagship activities that the Nutrition Innovation Lab supported were development and implementation of the first dietetics programs, that is the master's program and postgraduate diploma in dietetics. The second activity is the development of Malawi's first food composition database, and the third is the review of the medical curriculum for medical nutrition content. All of these activities were done to synergistically build nutrition capacity in response to Malawi's national priorities. These activities were also implemented by local partners, and these are the Lilongwe University of Agriculture and Natural Resources, that's called Luana, and the College of Medicine, now known as the Kamuzu University of Health Sciences. We also had regional partners in implementation of the dietetics program, and that included the University of Cape Town. In implementation of the food composition database, we also had regional partners, and that was the South African Medical Research Council.
The Nutrition Innovation Lab facilitated stakeholder engagement of many kinds to generate evidence of what works and channel it into the decision of the new professional training program. The project launched Malawi's first dietetics program, a 20-month postgraduate diploma which consists of didactic training, practical, clinical training, and an internationally vetted final registered dietitian exam.
So the postgraduate diploma in clinical dietetics is a flagship program of the Lilongwe University of Agriculture and Natural Resources that responded to a need in the country. Government of Malawi made it very clear that they needed dietitians science. And so through the conversations that we had with Government of Malawi managed to reach out to the United States Agency for International Development to look for assistance in terms of funding a training program for dietitians in our country. And that's how, through Government of Malawi, USAID, they managed to get Tufts University in the US to offer technical and financial assistance directed to Luana to mount a postgraduate diploma in clinical dietetics. That's where we come from. So the postgraduate diploma in clinical dietetics is so it's 2 years in duration. And so far, Luana has graduated 2 cohorts of dietitians. The first time we graduated 4, and then we also have graduated 6. These have already been placed in government tertiary hospitals at Queen Elizabeth Central Hospital, Zomba Central Hospital, Kamuzu Central Hospital, and Misolo Central Hospital. Malawi is now capable for the first time of training dietitians of international repute.
The experience has been so much good, so much fun. Shorter time frame of the coursework, lots of work, but then at the end of the day, you need to deliver. So I would also share experiences that we learned in Cape Town, in Blantyre, at Blantyre Adventist Hospital, as well as at KSH during the food service management rotation. So with these 3 or 4 combinations of experiences from different workplaces, I would say it was so much fun and we learned a lot of things. Now I am a registered dietitian working at Kamuzu Central Hospital full-time, whereby the demand is too much, as you know that we have few on the ground, and then we have lots of patients that they need us to review them.
The Feed the Future Nutrition Innovation Lab reviewed the medical curriculum for nutritional content.
As one of the major outputs or realms of our activities with the Innovation Lab was that we review the medical school curriculum for the program called MBBS, the Bachelor of Medicine and Bachelor of Surgery. As you're aware, within this training of medicine, doctors are meant to be extremely capable, of course, in medicine, in surgery, but what they also do quite a lot and significantly is nutrition content. So the objective and the purpose of this project was to assess the adequacy of the content.
The Nutrition Innovation Lab also successfully developed a new national food composition table for Malawi. This was an important step in professionalizing food-based consumer guidance. It was created through a collaboration between Lilongwe University of Agriculture and Natural Resources, Tufts University, and SA Foods Unit of the South African Medical Research Council. There was also significant engagement of stakeholders such as the Department of Nutrition and HIV/AIDS. This resource is now available for everyone to use.
The Malawi Food Composition Table was launched in February 2020, which is last year, and the compilation process began in August 2016. So it comprises of 316 food items, which are comprised into 8 food groups. These 8 food groups include the Malawi 6 food groups, with an additional of 2 food groups for foods that are special in the special food group, as well as an additional food group that includes food that do not compositionally fit into the current Malawi 6 food groups. The purpose of the food composition table is to serve as a scientific tool for people in different professions, including nutritionists, dietitians, people in the food industry, in trade. It can also be used by for nutrition labeling and in agriculture, and as well as policies.
I was in the second cohort of dietetic program and I graduated in 2020. But now I'm continuing with master's program at Rwanda, and my study there, I'm doing a research on nutrient composition and adequacy of hospital meals, and there I'll use food composition table. First of all, I use food composition table to calculate nutrient intakes of the patient. Those nutrients are energy, protein, zinc, iron, and vitamin C.
The Feed the Future Innovation Lab has undoubtedly delivered all its objectives, and the partners have great hopes for the future of nutrition in Malawi.
The Innovation Lab for Nutrition activities have been of great impact in Malawi at individual, institution, country, and regional level. For instance, with the dietetics program, Malawi now has its first 11 dietitians working in public service, and this is only the beginning of the dietetics practice in Malawi. Currently, we also have a dietetics association being established to support the practice of dietetics. Additionally, for the medical curriculum, we've been able to develop an adaptable framework that can be used to review medical curriculums across the region in countries that are of the same profile as Malawi, with the same resources, and therefore can adapt this framework to review the medical nutrition content in their curriculums. We've found that the tool will be even more useful at country level and regional level. For instance, currently the food composition database is being used as a resource in developing a web-based tool that is going to be measuring micronutrient deficiency, intakes, and adequacy. And so we look forward to all the future endeavors that these activities will be able to support and foster.